Have you been experiencing pain in your back or neck or somewhere else and you're hoping that chiropractic care will give you some relief? In this video, I will show you how chiropractic has helped others and how it may help you too. My name is Dr. Brad Fackrell from Synergy Spine and Nerve Center, and I have over 25 years of experience helping people to feel better. Now, I wanted to take a moment of your time today to share something that happened for me as I became a chiropractic patient over 3 decades ago, in hopes that you'll be able to get some similar relief. Some of my earliest memories are being in doctor's offices and hospitals. And I remember being in a bed with a plastic tent around me. It was terrible. It made it difficult for me to get a good view of the television, and I hated that. I remember taking medication every day, and one of the most significant memories I have as a child was trying to play hide and go seek with my friends, and how as soon as I would start running, I would start wheezing. You see, I grew up with severe asthma. This was my life. I remember really wishing that I could run and play like my friends could. Later, when I was a teenager, I wanted to become a respiratory therapist researcher so that I could find a cure for asthma. Now, of course, I didn't know that respiratory therapists really weren't researchers, and I didn't know that in my young 20s, I would discover that chiropractic would help my symptoms of asthma. Now, you may be thinking what I did when I first found out about chiropractic. How would cracking my back help asthma? Well, it's really similar to the way that chiropractic helps people with headaches, back pain, neck pain, and every other symptom that wonderfully improves when the health of your spine improves. You see, chiropractic's purpose is not to get you out of pain. The purpose of chiropractic is to reduce or remove the cause of your pain that's coming from your spine so that your body can start working better. Let me explain how this works. Your brain and your central nerve system is called your master system. In other words, your central nerve system controls and coordinates all other systems of your body. Things like your heart, your muscles, your digestion, and even your lungs. Every moment of every day, messages are being sent from your brain down through your spinal cord and then out through the spinal nerves to all the organs and tissues of your body. Then those organs and tissues do what the brain is telling them to do, and then those organs send messages back to the brain to give the updates so your brain can send the next messages. You know, all this happens quicker than I can just give a little bit of love to Nacho. If one or more of the bones in your spine become misaligned or they're just not moving properly, then the tiny nerves that are coming and going from your spine are irritated, and they send a message of stress to your brain. This is where many symptoms of pain and even things like asthma begin. That irritation that's on the nerve is causing some sort of response in the brain, and sometimes that will lead to pain, but not always. The mechanism of how this works I talk about in a different video called Spinal Hygiene, and I'll link the video description below. The thing that's important for you to know from this video is that irritation on the nerves from a vertebra that's misaligned or that's not moving freely is called subluxation. And it does not always create pain, but it is always, 100% of the time, causing a negative neurological response, one that will eventually lead to some kind of symptom. Now, as a chiropractor, I locate these subluxations, and I give adjustments to improve the way the bones move and how they're positioned. But my job doesn't end there. It's very important that I show you things that you can do differently in your lifestyle to help your spine and nerve system function better. So as you follow my recommendations, you will have improved health of your spine and nerve system, and your symptoms may also improve. The Spinal Health Assessment, or SHA, that we perform on all of our new patients helps us to determine what we can do to help you and what you can do to help yourself. This is why I encourage you to do your part in your healing. Your health is your responsibility. Your choices will dictate your health. If you make poor choices, you will have poor health, and when you make good choices, your health will be improved, I promise. Now, I look forward to being a part of helping you improve your health. If you felt like this was helpful, would you please give this video a thumbs up? And if you haven't already, please subscribe to our Synergy Spine and Nerve Center channel. This will help our channel grow and reach more people, and it will help you get notified when we post a new video that will help you have a better life. If you have any questions for me, please let me know in the comments section below, and I will do my best to help guide you. I do answer the questions. If you'd like to stick around for a minute, you can see some video footage of one of my recent bike rides that I'm now able to do because of chiropractic care and a healthy lifestyle that has improved my symptoms of asthma. I hope that you will enjoy better health and less pain because of your chiropractic care and your healthier lifestyle choices. Your health is your future. I hope that you have an absolutely wonderful day. Today we are at Angel Fire Bike Park in New Mexico. Angel Fire doubles as a ski resort in the winter time, and just like ski resorts, there are green runs, blues, blacks, and double blacks. We are on a trail called Hungry Hippo, which is a black. One of the reasons I like this trail is because if an individual is newer to mountain biking and they are very confident in riding blue runs, well, they can start graduating to a black, and all of the jumps and drops on this trail can be skipped. There's a ride around, and that makes it nice for somebody who really wants to kind of push their levels a little bit. You can see here my buddy does the ride around. Now, the reason why he does the ride around is very important. As you see here, this is a run that we took earlier. He took it, and oh, whoa, he almost loses it there. Again in slow motion. This is a sign of an incredibly skillful mountain biker, somebody that can almost fall, but not. It's important for me to mention here, the buddy I'm riding with, he is a very skillful mountain biker. He's much better than me. He got me into mountain biking over a decade ago. And in mountain biking, if I want to become a better mountain biker, I have to be willing to go out of my comfort zone, ideally in a safe manner. Well, as a patient in my office, I ask you to do things that are sometimes out of your comfort zone, different than you've normally done in the past. Your past has got you to the place where you are. You're now wanting help. And if you are willing to go out of your comfort zone and try things that are out of your ordinary, your outcome of better health that you're seeking can happen if you're willing to follow those recommendations. Now, I could watch mountain bike videos for a very long time. I know you probably don't like it as much as I do. I want you to know that I appreciate you watching this one, and I hope that you have an absolutely wonderful day.